My name is Jerry Elder. I live in Cartersville. I had been out doing some running in preparation for training and so forth, and I had about an hour after it was over with, I had severe pains coming across my chest. And after I waited a while, they didn't get any better, so I felt like I needed to come to the emergency room. It was on a Sunday night. The emergency room was pretty crowded when I came in, but I was having pain, and one of the ladies in charge knew that I was having problems. So they started the EKG right off the bat and took care of me. In the emergency room, I actually had my heart attack while they were doing the second EKG, and I remember very vividly them saying, "Is a trauma room ready?" And so from there, I went to the trauma room, and then a lot of activity started taking place. So it was well organized. They were the team. Each one seemed to know what they were doing, but they were doing it rather rapidly.
Talk about Mr. Jerry Elder. He presented to the ER, and approximately September the 30th, individual came in with a typical chest pain. Came in, had a little chest pain in his mid-sternal as well down his left arm.
So one of the most important things when we assess patients with chest pain in the emergency department is obtaining that EKG within a very short period of time. So our goal is to do all EKGs within 10 minutes of us knowing that the patient's here for chest pain or a possible cardiac-related complication. The sooner we do that EKG, the sooner we can either rule in or rule out the fact that they are in fact having a heart attack. The doctor will take one look at that EKG, and if it's really obvious, it's something we call ST segment elevation MI. We have very characteristic pattern, we recognize it right away, and we can activate a STEMI code and get the patient the help they need by activating a STEMI team, a cardiologist in the Cath Lab, to get that patient as soon as possible to the catheterization lab, usually within 30 minutes of us realizing the patient's indeed having a heart attack. The role of the emergency department physician is really that of identifying that EKG findings and activating the STEMI code. Once that STEMI code is activated, things flow great from there on. It's all protocol-based. The nurses know what to do, who to call to get this process activated and the patient treated. Even the medications are part of the standard protocol, and it leads to very limited variability in terms of treatment. That means to the patient that they're all getting the same care regardless of who the physician is.
Well, the ones that I remembered was them getting ready. They were going to do the heart cath through my arm. They were able to do it there, and then I can remember looking at the TV screen monitor for just a moment or two, and then the next thing I remember was kind of coming out of everything and hearing what had actually happened and finding out what the doctor had found as far as my heart.
We are the Cardiac Cath Lab team from Cartersville Medical Center, and we are here for your emergent cardiac needs 24 hours a day, 7 days a week, 365 days a year. Once you are assessed in the ER, and should the need arise, you'll be brought to the Cardiac Cath Lab, where we will use specialized equipment to open up the blockages in your coronary arteries. This should effectively end your heart attack and relieve your chest pain.
Dr. Prempe was a doctor that did stents. I had to have 2 stents. I had a 95% blockage, and they were able to pretty rapidly get in and relieve that blockage. And later I found out, that as a result of their quick action and what they did and how they handled it in I must say, a very professional way, that I wound up with no damage to my heart. I can't remember the names of anybody at that particular time. I do remember their comments, and they commenting on the fact that they did things. I could tell they were in a hurry, but they commented on the fact that they were looking after my health, and they all did a fine job. I was in the intensive care for about 2 days and 1 night, and then I was moved out into a room on the floor late the second day. But I remember Lori Pittman was one that came by and checked on me, and she was very instrumental. I can't remember if she was there the Sunday night when I actually had the heart attack or not, but she's one in particular, and there were several nurses, but all of them were great. They took care of me in a very fine way.
My interaction with Mr. Elder started after his heart attack. So he came to the hospital having an acute heart attack, which is scary to a lot of patients to acknowledge that they're going through this and that this could possibly be happening to them. One of the big things that we concentrate on is to remind patients their life has not ended, it's just going to change, and the adaptations that they need to make into their lifestyle. And Mr. Elder was very, very, he was very eager to learn what things he needed to change in his life. So with his diet and exercise, cardiac rehab, and the changes he needed to make in his life to have a very active lifestyle following a heart attack. When people are having a heart attack or they're experiencing chest pain, the first indication they have is to kind of, not acknowledge that that's happening to them. So they wait or they drive themselves to the hospital. And I remind people that you need to call 911 if you're having these symptoms. The ambulance is not just a faster ride to the hospital, but it alerts us that, that we have a patient with a heart attack coming in. We can go ahead and start giving treatment to that patient to reduce the damage to their heart before they ever arrive to the hospital. And Mr. Elder is the poster child for any patient who suffers a heart attack and taking ownership of the lifestyle changes you need to make, the follow-ups that you need to make to promote the healing and the healthy lifestyles that are going to benefit your heart.
I have cardio rehab 3 times a week, and my attention and impression of the people that's running it seems to be doing a good job.
Mr. Jerry came to us after his cardiac event, and unfortunately for him, he didn't actually fit the mold of what we consider to be a cardiac patient, which tells us, cardiac disease can occur in anyone. It doesn't necessarily have to be a patient that's overweight or one that doesn't exercise or eat healthy, because we see all walks of life in cardiac rehab. The majority of people that come in here are overweight. They don't eat healthy. Genetics is a factor for them. But the biggest concern is to actually get them up and exercising, because they don't incorporate exercise into their lifestyle on a daily basis. And our goal here is to get them to where they're doing 30 minutes of exercise at least 3 to 5 times a week. The benefits of cardiac rehab are many. It decreases your chances of dying at an early age. It decreases your chances of having a repeat cardiac event. It also lowers your cholesterol levels. It increases your HDL, which is your good cholesterol, and that's what we like to see very high. Everything else we want lower. But it does increase your good cholesterol. It lowers all your bad levels of cholesterol. And in some cases, it actually reverses the fatty plaque buildup in your cardiac arteries. It decreases your stress levels, your depression, your anxiety, which we have found, plays a major role in contributing to heart disease and heart ailments.
Gives you a kind of an orderly schedule for gradually building up your heart muscles and getting you back into shape. And they also point out that the possible dangers of somebody wanting to get back on their own exercise program and maybe doing too much too quick and maybe create some problems and so forth later on. Probably the major thing that, although I'd already been trying to watch my diet and have a healthy outlook in regards to what I put into my body, the biggest change probably here is going on a low salt or no sodium diet as much as possible, and then to watch some of the other foods that before I ate that I don't eat that much now. Basically, my ideas as to why I chose it, to be frank and up front, I was not sure that the facilities here at the Cartersville Medical Center was in position to do and treat heart attacks. I've lived here for a number of years, and I guess it's my fault that I didn't know more about what Cartersville Medical Center had to offer. But I had was considering, going to somewhere else, which is things that, you think about sometimes. But I'm glad that I came to Cartersville Medical Center, and I can recommend the Cardio Lab and Dr. Prempeh and what he does and what he did for me. I know where I'm going to be now in the future. Well, I think quite often people may have a preset idea of what somebody might look like that has had or will have heart problems, and you look at somebody who's obese, overweight, who smokes, who doesn't take care of their health, don't watch what they eat. This is just my personal feeling, is watch what you eat, don't smoke, don't drink, and you take care of your health, and have some regular checkups in regards to your blood workup, know what your cholesterol levels is, know what your HDL, LDL is, and take steps to try to keep that under control. And always keep in mind your family history. You don't, just because everything's going good, don't put that aside and think that it won't happen to you. It did to me.